Hello, listener. This is The Way In, a podcast about finding our way through the often impenetrable worlds of psychotherapy, psychiatry, and psychoanalysis. I'm your host, Tyson Connor. I'm a psychoanalytic psychotherapist and clinical supervisor in Washington State. Each episode of this show, I talk with other mental health professionals about the work they do and topics they care about, using language that you don't need an advanced degree to understand. Come join us as we try to find the way in.
And today, our guide is Dr. Cameron Boisen, licensed clinical psychologist. Dr. Boisen will be our guide into the topic of psychodynamic psychotherapy for transgender people. Cameron is a psychoanalytic psychotherapist, failed academic, and heretic, currently living in the Netherlands and working in private practice remotely in the Seattle area. Their practice focuses on depth therapy for transgender people, marrying the work of analytic exploration with understanding the lived experience and practical needs of this group. Cameron, welcome.
Hi, great to be here.
So, I am very excited for this episode. This is a topic that I have been wanting to do an episode on for a long time, and so I'm going to try to contain my excitement and let you speak from your expertise and experience. But I might be a little bit excitable and giddy, and especially for coming and joining me all the way from you're across the world and you're setting aside time to make this work. So I really do appreciate it. I'm very excited for this. And a question that I like to ask all of my interviewees, all of our guides, is built off the idea that all theory is autobiography to some degree. Would you mind sharing with us, to whatever degree you're comfortable, how your autobiography intersects with our topic today? Where's your interest and experience come from?
In terms of how I kind of come to psychoanalysis and the theoretical orientation?
Sure, yes.
Sure. So that's a funny story, in fact. So I received my higher education at Duquesne University. It's in Pittsburgh, Pennsylvania, over on the East Coast. And it's a notable university insofar as it's a human science program and it's an existential phenomenological program. So very steeped in continental philosophy, and human science perspective. So that was a big reason why I chose it. I was coming off of undergraduate study that taught me a lot about existentialism philosophy. And so I thought, and this is one of the, certainly at that time, very few programs in the US that was offering that perspective. So I was like, this is great. I'm going to go and get all of this, Viktor Frankl and Carl Rogers and great stuff going. And then come to find out, as I was there, it was about half psychoanalytic, which I was pissed about. I hated the perspective. I thought it was outdated. I got the undergraduate take of it, which is, here's Freud, who's a cokehead focused on the genitals, and nobody uses that stuff anymore.
Right.
So I was deeply resistant to the perspective, really, through my first several years. And it was not actually through my education, but through my clinical work. I remember very strongly a particular clinical moment that I was working with a client and, she was expressing a lot of shame and finding it difficult to go on with what she was telling me. And I was, operating from this humanist existential perspective, phenomenological lived experience. I'm there with her in the moment. I'm like, it's going to be okay. Like, I'm not going to be disappointed in you. Like, we can share whatever comes to mind. And she burst out, but you're not my father.
Ooh.
And it was just this sort of slap in the face where I was like, man, I guess maybe this childhood stuff matters more than I thought.
Yeah.
So I, in the latter half of my study, took the analytic perspective a bit more seriously, gave it a little more credit, bothered to read it on some of its own terms. I was very lucky to study under Bruce Fink, who's a Lacanian scholar and of quite a bit of note, and who really helped me to understand that this was not sort of this wasn't a perspective about the psychosexual stages as I learned, because that's the easy thing to memorize when you're an undergraduate and you've got to give an exam to undergraduates.
Right.
But a perspective about really taking all parts of the person into account and understanding sort of the ways in which we are formed by all experiences, and that childhood gets focused because it's what we tend not to focus on. And that whole sort of notion of looking where we are taught not to look, and understanding duality of meaning. Lacanian analysis is very interested in language and double meanings and slips.
Right.
And that, my father's a linguist. I'm a writer. So there was something about that made a lot of sense to me. Like the idea that everything can also be other things and can also be access into elsewhere.
Mm-hmm.
And I sort of did a little a case study for myself, which I thought was interesting. I had 2 clients that I took in at the same time. And I thought, well, okay, I've got these new 2 clients. I'm in my training clinic. I'll try this psychoanalytic stuff with both of these, and I'll see how it comes out. And, the cases in the work were interesting. And they also happened to be 2 people who in that space formed completely opposite perspectives of me.
Oh.
One was like, you are the most brilliant person. I can't believe you're helping me so much. How are you doing? What's going on for you this week? I'm just so grateful that you're here. And the other hated me.
Wow.
I see you sitting over there with your smirk. Why don't you just tell me what you think?
Whoa.
And I was doing the same thing.
Yeah.
Right.
Yeah.
So that really evidenced to me, okay, there's really something here, both in terms of the content areas, the stuff in childhood that is important and gets stuck there, and the way of being, the ways in which we cast outward what's held within.
Yeah. Yeah. It's interesting how, I don't know where each of these interviews will go in my release, but listeners to this show will have heard me talk to Daniel Benveniste about Freud and about like common misunderstandings of Freud and how we can make sense of Freud. And it's interesting to me how often people's introduction to the world of psychoanalysis is, oh, that's some bullshit, basically. Like, like we don't...
Nobody does that anymore.
Exactly. We don't do that anymore. And how many people's experience seems to be, and then I tried it, and then that made a huge difference. So listeners to the show will also have heard me define transference 100 times before, but transference being the way that previous relationships sort of create a template for future, especially close, intimate, emotional relationships. And just hearing how transference plays out between those 2 clients, right? Where one feels very close and connected and the other feels you as distant and different. Just seeing the reality of it. That's a powerful experience. Yeah. So today we're going to be talking specifically about bringing psychoanalysis to the context of like gender. Yeah. Do you want to speak to a little bit of your biography on that, or do you want to just let our conversation speak for itself?
Sure. No, I can speak a bit to that. So yeah, I've wound up as a sort of psychoanalytic psychotherapist for transgender people, and that both parts of that are accidental, I suppose. So I've told you both how I kind of accidentally wound up as a psychoanalytic psychotherapist. I also sort of accidentally wound up as a transgender specialist. I am queer, I am transgender. That's been its own long journey. I'm non-binary, and I've identified that way for, 15 years or so. Back when that was not the common term. I really thought genderqueer was going to win the race on this one. They were the two top contenders in the early aughts, and to my chagrin, non-binary has won out. But so I opened a private practice as a bit of a backup plan. So in my bio, I say I'm a failed academic, and that's the truth. That is what I wanted to do. I loved university teaching. I really wanted to follow that path. I had a PhD in clinical psychology and lots of clinical training, but I felt like, this therapy work, it drains me. And what I want to do is I want to do teaching and research.
Right.
I couldn't get a job. Academics are very tough all over, but especially in the US. And so despite being very decorated, very published, very well granted, I couldn't even get an interview anywhere.
Wow.
So I thought, well, okay, I've got the training and I got to pay my rent. So I'll start a private practice on a wing and a prayer. Someone was willing to sublet me an office once a week, and the money for a website and a pack of business cards was not so much. I thought I'll give it a shot and see if anybody comes.
Yeah.
And really build myself as, anybody who wants to come, please come on down, depression, anxiety, adjustment. But who came was queer people, and more specifically, trans people. For a while, it was surprising to me. I have to imagine it is actually mostly based on how I look. And so this is an interesting, we talk about transference begins from the moment the client decides they want therapy.
Yeah.
Before even encountering the search tool on Psychology Today, before sending the email.
Yep.
So how much people were just seeing me and seeing there was something about me that they understood to be at peace or open to gender exploration or gender transgression.
Yeah.
And the more experience I got with that, then the more I was like, well, okay, I guess here, I'm a generalist. I can do all these things and I can specialize in these things. Yeah, I began writing letters for surgery. I had written one, I believe, on my residency and my postdoc internship. But really, I did not write them until I entered private practice a couple years in. And so I started writing them maybe 1 or 2 years in, letters for surgical supports. And that became a more and more common practice for me, and then eventually became, a service that I advertise on my website. I've done, by my estimation, between 200 and 300 at this point. So it evolved really by who was coming to see me, and me at first being actually quite surprised by that. And then choosing to lean into it, choosing to kind of lean into more and more niche of, what I do actually is this one very practical thing. I can get you a letter so you can get your surgery.
Right.
And the absolute opposite end of we can do, 4, 5, 6, 7+ years of depth psychotherapy. And you will... The phrase that's in my mind is have some reassurances that this is a place in which certain questions don't have to be dealt with quite so virulently or from perspectives that may be highly suspicious. And so this is where the intersection with the blank slate of analysis, which I actually do really believe in, is complicated. And it's complicated in all situations, and this one particularly.
Right. Yeah. So for our listeners who might not be aware, when you're talking about letter writing in most places, I think, but definitely around here in the US and in Washington, for someone to get gender affirming surgery, top surgery, bottom surgery, there needs to be a letter written by some kind of a mental health professional, essentially saying, yes, this person wants these things and they're not mentally unwell. They're not psychotic. They're not crazy. This is gender affirming that will affirm their gender. This isn't the expression of some psychotic episode or manic episode or something like that. And that's part of the system. So when you talk about this dichotomy that you're in, listener, what Cameron's describing is kind of like the oddness of the mental health system and how all trans people need to interact with it in some way. And
hello, listener. Editor Tyson here, just to clarify a point that interviewer Tyson was just discussing. The short version is you do not need to interface with a mental health provider for all forms of gender-affirming care, at least in Washington State. You are able to access hormones, also called HRT, hormone replacement therapy, without getting a letter. I'm just going to quote from an email that Cameron sent. We discussed this a little bit, and this is how they summed it up. Regarding your note with regard to HRT and letters of support, as far as I am aware, letters are actually never required for HRT in Washington, as Apple Health has not required them since, I believe, 2015. They are indeed required for HRT in some other states, and surgery always requires them, though how many, by whom, and somewhat what they address are all variable details by state, insurer, and surgeon. So, That's what Cameron had to say on the topic. Short version is you can access some gender-affirming care without interfacing with the mental health system, but currently, if you want a surgery, then you have to. Hopefully that clears things up.
If you're a regular listener to the show, you know I ask my guides to come up with an outline. Well, this time I came up with the outline because I had some questions to ask. And this conversation actually dovetails really well into the first question that I have. And I would love to hear your thoughts on it. So psychotherapy or some engagement with a mental health professional is a requirement for gender-affirming medical care to be approved. Why is that? Is that based on a real need trans people have to receive psychotherapy while, before, during other care? Or is it a roadblock erected by cis-normative transphobic systems? Or is it some combination of the two? To shorten the question, the system requires that trans people talk to mental health professionals to get gender-affirming care. Why is that? And is that really helpful?
Well, yes, so this is one of my favorite talking points in some ways, because I think it's a misunderstood one from all sides. Is it necessary? Is it a form of a cis-centered or transphobic system? Is it both? I think it's possibly both and neither. It's like, I think, unfortunately, a lot of things in the world, ultimately or initially, well-intentioned system that has outgrown its pot, as it were, and which, like, roots are breaking out in strange ways. So your summary of what is said in the letter, mostly correct. However, I wish that it was actually just a letter stating that your gender dysphoria is not due to another mental health source. In fact, what is the most crucial part of the letter is the diagnosis. Right. Is that you have met with a mental health professional and you've been diagnosed with a mental illness.
Right.
So why does that have to be there? That has to be there at this point, largely not for the surgeons, actually, but for insurance, because insurance will only pay for a treatment that is medically necessary. In order for something to be considered a medically necessary treatment, it must be treating a known and recognized disorder.
Right.
So we're in this really strange moment where the only reason that anybody is getting their surgeries covered by insurance, and I remember a time that they were not, right? So
sure, yeah.
Being myself, gender variant for 15 years or so here, I remember a time when nobody was getting there. It was the idea that insurance would pay for your surgery was a literal joke.
Right.
Everybody just ran fundraisers. I myself had sort of resolved I will not get surgery because I was like, well, I'm never going to have a 10 grand just sitting around.
Right.
So I remember it was in 2010 that Medicaid made a ruling that has triggered a lot of private insurers because they sort of set the role. So this has been a very recent shift. And it's this marriage of strange bedfellows. So I want to go back actually even a little bit further of sort of what is the history of how we come to have these rules that require it, and what were they ever meant to do? Because you will hear a lot of people now talk about WPATH, which is the World Professional Association for Transgender Health. So they're the body, the basically governing body that sets the standards of care, SOC, of transgender health. And they do that much in the same way the APA works, right? We've got a ton of professionals, psychiatrists, psychologists, mental health therapists, doctors, and they are forming committees and coming together every few years to say, here's what we're noticing based on patient experience and based on research. How do we amend what we think are diagnoses and treatments, et cetera, right? It used to be called the Harry Benjamin Society. So in a time, which is not so long ago, we only have to go back like 100 years or so. And the Hirschfield Institute, if your listeners may know, was a university educational research center in Germany that was actually doing quite a lot of research into transgender, transsexual, transvestic at the time called different forms of gender transgression. They were burned to the ground and all of their research destroyed by the Nazis, which set back our understanding of transgender history and transgender research a truly unknowable amount. Where we would have been without that is quite tragic and difficult to speak to. So what we got at that, moment in time where there was some blooming of understanding of, these are many different ways to be a person. And these are historic, cross-cultural, many different ways to be a person. I come from a social constructionist sort of perspective. So to my mind, what does it mean for something to be real? Real means it occurs across cultures and across time. And there's very few things in one sense that fit that bill.
Yeah.
Gender and gender transgression is one of them. We find third genders, we find gender variants, and we find gender, the notion of gender, in basically every place we have ever encountered and throughout time. So this is a historic thing we do.
Yeah. I want to slow us down a half step.
Absolutely.
Because what I'm hearing you say, just to make sure that I get it, and also to clarify for the listener, a social constructivist is someone who, as I understand it, it's a philosophical position. It's a question of ontology, right? Like, how do we know what is real? Those sorts of epistemology, maybe. What is real? What exists? And a social constructivist is someone who says, like, what exists practically for the sake of this conversation is what we all socially agree exists.
Correct. Yeah.
It's how a society organizes itself. And what you're identifying is that throughout history and throughout cultures, yes, gender has been present basically everywhere, maybe actually everywhere. And so has gender transgression and categories for those who transgress gender.
Correct.
And that feels pretty important for me to slow down on, because I know that some folks listening to this might even experience the reality of a trans person as a threat to the reality of gender. And I have even known some, I think, very well-intentioned folks who were gender abolitionists, who said gender shouldn't exist. We shouldn't even have it. We should just get rid of it. And what I'm hearing you say is that it's more nuanced than that. It's more complex than that. That, like, gender is a real thing. And it's also really been true forever that there are those who transgress the, like, major gender categories that exist within a society. And that historically and currently, society has the capacity to make space for making sense of folks who transgress. Am I hearing you well there? Is that more or less? Yeah.
Well, and even, that I'm using, the word transgress says something about the moment we're in, right? And how we understand what gender and gender categories are, right? So that there's variance. So, there's all kinds of cultures that we see where there's many genders, and maybe they're sometimes tied to sex, and maybe they're not. Now I'm not going to be able to get the details right. I used to teach an example in psychology of gender. I can't remember the region, and I don't want to say a random one and get it wrong, but it was a very remote indigenous region. An anthropologist went and was interested to see their notions of gender, and her exploration and understanding was they did something like gender, and gender was based on skills. There's one gender for people who could wash rice, and one for those who could sow seeds and harvest. And they really couldn't understand her or what her gender was because she couldn't do anything right. And had no knowledge of how to do anything. So they were like, what is going on with you? Despite being very obviously able to see her genitals, because she would have to use the river for bathroom and for showering and everything. So we see gender everywhere as a way of categorizing people. Very often linked to sex, at least somewhat, though not always.
Yeah.
And we see people who fit in categories of gender that don't have anything to do with biological sex. But what do we make of those people? That has everything to do with culture, right? Whether they are freaks or perverts, whether they are mentally ill and pitiable, whether they are sacred and able to bridge gaps between either other genders or between the divine and the human. So two-spirit is kind of a gender category recognized in many Native American communities.
Yeah.
And prior to Western colonization, my understanding, in many communities, not in all, that was very revered kind of identity, or an identity that was seen to be able to have more than either just men or just women could do.
Right.
Hijra, also a sort of third gender in India and Pakistan, again, prior to Western colonization, a very important part of spiritual systems, seem to be sort of imbued with more kind of spiritual verve, as it were, providing blessings at births and at weddings. Now, of course, Western colonization changes all of this. It changes the categorization and the value. It also changes how these people experience themselves, and then how they are experienced within their communities.
Right.
So there's all kinds of ways of understanding what people are doing when they do gender differently.
Right. Yeah, we are using the language of transgress, and this is a bit of a tangent, but recently what went around the internet was someone asking, all right, what's your favorite bit of lore from the Star Wars universe that's just bonkers? And one of the things is that in the Star Wars universe, Anakin Skywalker invents the phrase transgender because there's a conversation with a transgender person who is saying, I was worried that the Jedi wouldn't accept me. And he says, the Jedi are all about transcending things. I think we'd be totally fine if you've transcended gender. And that comes to my mind because when we talk about people who, for whatever reason, do not find themselves within the gender categories generally supplied by society, this prefix trans shows up. And what it's followed by sounds like suggests a lot about how a society is going to make sense of those people, or how a society is going to help people make sense of themselves. Transcendence is one way to think about it. Transgressing is one way we've talked about it. Transitioning, even as a word, I've found times where I feel like transition feels like a wrong word to use with people because it implies something about a switch from one to another. It kind of reinforces the binary in some ways, or it can feel that way. I don't know what to make of that, just to notice it. Listener, what we're talking about is the historical reality of trans people, the historical and sociocultural reality of trans people, the undeniable reality of trans people, which I think is important background for us to be able to talk about my next question, which is, once a trans person is in psychotherapy, how can that psychotherapy be helpful, especially in regard to their relationship to their gender? And part of the reason why I even asked this question is because modern psychotherapy, especially psychoanalytic psychotherapy, is deeply entrenched in a Western, imperialistic, intellectual tradition that has a lot of investment in reinforcing status quos, in so much as, you know, you were referencing earlier the Lacanian tradition of like looking at and talking about what we're not supposed to see and talk about. In so much as that's deeply embedded in our tradition, so are the values of dominant culture. And even the hyper individualism of psychotherapy. It's two people in a room talking. And, you know, 2 minutes ago, we were talking about how whole societies make sense of the use of gender. So okay, Tyson, pare down your question so that Cameron can actually say something to it. What do you see the role of psychotherapy for someone who is trying to engage meaningfully with their gender?
Well, I want to back up and complete a little bit of my very long answer, if I can, of sort of where do these standards come from, and why are trans people in therapy at all?
Right.
And that there may be two situations in which they are so. I'm going to say there's maybe three situations.
Okay.
There's innumerable situations, right? But let's talk about three sort of categories. So as the world transitions, becomes marked by imperialism and colonization, fascism particularly, we get a need for higher and higher categorization of people. A resource I did not put on this list, but which I would encourage anyone to read, is Michel Foucault's Discipline and Punish. Because I think his thinking about the ways in which we use identity to categorize and police people couldn't be more prescient. And so he writes a lot about that kind of way in which we learn to internalize labels to police ourselves along with them. So here's where I think there's something of a well-intentioned system that's gone horribly awry, right? So the world is
the road to hell and all that.
Right? So the world is sort of rising in an understanding of people who do gender differently are not good. They are not sacred. They're not divine. They're not wise. They're not even different. They are bad, right? They are doing something wrong. They're doing something morally wrong. And they are doing something mentally wrong. They are crazy, right? That this is a delusion to think that you could ever be of a different gender than you are, right? And that's becoming a dominant perspective because it makes people easier to control and easier to categorize and easier to put down. So what becomes WPATH for the Harry Benjamin Society is actually a group of medical professionals who are interested to say, I don't think that's true.
Yeah.
And in fact, when people get access to medical intervention that helps them to realize their delusion, quote unquote, as it were, they don't seem so deluded anymore. And they don't seem to have trouble forming relationships or working jobs or doing any of the other things we think of as mentally ill, right? So they challenge the idea that this is fundamentally a mental illness that should be put down, basically discouraged, and instead that people should be granted access to treatment in the form of a medical change, which is not how we treat mental illnesses. We don't change your body to treat mental illnesses.
Right.
Almost always.
Yeah.
We could have a whole nother discussion about brain science and whatever.
Sure.
But these are friendlies, right? These are folks who are saying, we don't think you should just have to live your whole life as a man if you do not feel that to be true. We think actually you could wear women's clothes, gain access to things that make your body shaped in the ways you want, live in a role that's congruent with the way that you feel, and you're going to be fine. You're not ill in that way, right?
Yeah.
But nobody believes that. So in order to demonstrate that, they put in the standards of care. Which is to say, okay, well, we'll see this person for like a year of psychotherapy, and I am a professional, and now I've seen them for a year of psychotherapy. So, and now they've been living full time for a year. They've done all these steps. So look, you have to give them access to these medical interventions because they're not crazy. And I can demonstrably say they're not crazy because I'm a specialist in this field and I've spent a lot of time with them.
Right.
So that's where we get the first requirements for treatment that trans people have to be in psychotherapy. So was it for their own benefit? No. Was it a result of a transphobic world? Yes, but in a roundabout sort of way.
Right. As you're talking about this, I'm thinking about how so much of our work as psychotherapists is often helping people to identify ways of functioning, often internally and externally, that were survival in the past, that have become trouble in the present, of ways of thinking of oneself, of interacting with people that like was necessary to get by, often in early childhood or early adolescence, that got stuck. And now those patterns of interacting cause trouble, and we try to unstick and find ways to avoid trouble. And it sounds like you're describing a very similar process in the world of the reality of trans identities. The society at large said, well, those people are just crazy. You had a group of medical professionals who said, actually, like, okay, maybe they are, but it turns out if you help them to live in accordance with their felt experience, there's no negative consequence. And in fact, things go better for them. So let's just reframe the conversation from they're crazy and need to be fixed of their gender dysphoria to, well, actually, the cure of gender dysphoria is gender affirmation. And now we're in a moment where for a trans person to receive medical care for their transition, you need to call it a disorder. And now we're in a place societally where we're closer, at least in some spaces, to saying, actually, maybe this isn't a disorder. Maybe this is just part of human variation. Maybe this is just part of like our species. But we have this legacy system that's very deeply tied to this category of disorder that we're needing to like wrestle with.
Right. Well, and because we also enter a moment culturally that's very into biomedicalism, right? We gain scientific advantage and medical advantage. That makes us start to think about people in a natural science, in a biologic and an evolutionary based way, which, by the way, doesn't refute and in fact supports the argument for gender variance as a quote unquote natural part of life, if by what we mean by that is biologic.
Right.
Another resource, which I've not written down, but which would be a good one, Evolution's Rainbow. And it's about gender variance and same-sex relationships in animals, of which there are a great many. So yes, we have this strange swing from basically gender transition isn't a thing. If you think you are a different gender, you're just crazy. And the role of mental health professionals to say, these people are not crazy, give them access to the life, to the phenomenology, to the lived experience that they want. And so the only path forward is this long round of psychotherapy to say you're not actually crazy.
Right.
Now we're in this strange other moment where the only path forward to transition is to say that you are crazy.
Right.
Is to say you have a diagnosable mental illness and you need medical treatment for it. So when I say there's three sort of paths of how I interact with transgender people in therapy, let's say.
Yeah.
One is just appeasement of this system, right? Can you please give me my stamp so that I can go get my surgery?
Right. Jumping through the hoop.
Yeah, and it's little more than that, right? So I conduct my assessments from basically a perspective of informed consent. Is there any reason why you can't make this decision like you make every other decision? Like you're able to testify in court or sign a contract for a job or a lease for that matter. If you can do all of those things, then you are reasonably considered an adult by the United States of America, able to make your own decisions.
Right.
I can assess whether you have psychosis or addiction problems or other mental health reasons that would render that not true. But if it is, you should be able to do what you want. But I also have to afford a diagnosis that compels their treatment to actually be covered. So that's one reason in which I interact with people. So they're coming in, they just need this letter. So it's very much about their transition, but it has nothing to do with them at the same time.
Right.
At the opposite end, I have people who just need therapy and they just want to talk to someone and they happen to be trans and they would like to not talk about being trans every time.
Right.
And they would like to actually talk about their childhoods or their relationships or their jobs with a baseline understanding that they are trans, but without the conception that their being transgender necessarily has anything to do with the particular struggle they may be facing with their roommate not doing the dishes.
Right. Yep.
And then a third category of, people who are coming into therapy and they do want to talk explicitly about gender. So I do, of course, see folks who have sought me out because they feel gender curious or gender ashamed.
Sure.
That they have some sort of feeling within them and they don't know what to make of it.
Yeah.
And they need a place to discuss that. And right now, the cultural moment is still so pronounced in evaluation. Is this right or wrong what you're doing? Are you ill or not? Do you people even exist or are you just delusional? We're back to that.
Right.
So they want a place in which to discuss these questions and to not have to worry about that evaluation.
Right.
Now, that should be any therapist. It should certainly be any psychoanalytic therapist. We hold non-judgment at the core of what we do.
Do we, though?
Is it?
Do we, though?
Is it, in fact? The number of people seeking me out because I got short hair would indicate otherwise.
Right. Oh, gosh. Yeah. How do I want to manage this transition? So part of the reason why I've been so desperate to try to figure out how to have this conversation, like I was trying to find someone to talk to a year and a half ago when I was on a different podcast at a different group practice, because I felt this deep and honestly, like at times painful for me as a therapist, as a cis therapist, tension, where I have a lot of trans clients. I have a lot of trans clients who are children, who are adolescents. And like, that's a bit of a That's a bit of a hot topic. That's a bit of a firecracker of a topic. When this podcast episode comes out, my dad is going to lose sleep about it because he'll be worried about what happens to me by being open with the fact that I am gender affirming to teenagers.
Sure.
And given the town he lives in, that might be a genuine concern.
Sure.
But I don't live in that town, so I visit rarely, and I don't think anyone there really cares that much about me. Point being, and I'm... I'm a cis straight white man, right? But still someone's worried about me because of my stance on this thing. Not even about my identity, just where I stand. So there's some energy here. There's some heat here. So that's part of it. Mm-hmm. Another part of it is I've been in this psychoanalytic world for over a decade now. And I have found that when I bring my trans clients to consultation or to supervision in psychoanalytic spaces, it is a full-on toss-up. It's a coin flip. Mm-hmm. Am I going to get the kind of consultation that I usually get that helps me think more deeply, that helps me engage with my experience of this person, that helps me feel like I can show up with them in a helpful way? Mm-hmm. Mm-hmm. Or are we just going to pathologize their gender identity for the next 50 minutes and are we going to waste my time? I've left supervisors and consult groups because I full on could not talk about certain clients because they just went there so often. Yeah. And so that's one side of the coin. Psychoanalysis just treating anything that's not cis and heterosexual as pathological. Yeah. And then the other side of the coin is I have clients who actually do want to engage with their gender.
Right.
Who actually do want to explore and get into it and be curious. And when I go to more explicitly affirming contexts, it feels like gender identity is like someone telling you their eye color, right? Mm-hmm. It's just well, it is what it is. Mm-hmm. And if I'm okay, but how did it get there? Then I'm standing a little bit too close to the bigots.
Yeah.
So how do you walk that line? Teach me, trans person, says the cishet white boy.
It's such a challenge. I don't know. Maybe I'm an optimist at heart because I'm always sort of both willing to see good parts, right? And to understand intentions, right? So I can recognize there are a lot of analysts who talk about gender so badly, and it's because they understand it as this really fixed and complex focused thing.
Yeah.
That said, I guess where I take my inspiration from and where I think analytic thinking does really well is that psychoanalysis has always been about the taboo. Mm-hmm. Psychoanalysis has always been about the unsaid. Mm-hmm. The origins, the understanding of hysteria is something is genuinely happening to these women and they can't talk about it. And so all of this fucked up stuff happens as a result.
Right.
And here's where there's a really interesting, I think, marriage between psychoanalysis and social constructionism. Mm-hmm. It's easy to look in those textbooks and go look at Papa Freud and be like, oh yeah, sex and violence, so that's the taboo stuff. But I talk with my clients about their sex lives or their masturbation or their violent fantasies all the time. We're getting into it. Sex and violence were what he writes so much about because they were the social topics that were taboo, that were not acceptable to talk about.
Right.
And they're still somewhat unacceptable to talk about. However, we get different taboos with different societies.
Right. Yeah.
So what you're explaining, which I think is extremely valid and also the way that I experience the world, is that there ends up being these two stances. You're either validating or you're pathologizing.
Right.
And the middle space for exploration is gone over. And that is the function of a taboo. That is what it means to be taboo.
Right. Yeah.
That it is either pathologized or lived out in often destructive ways. Right. Because they are not actually explored. Mm-hmm. Mm-hmm. Yeah. So I think gender is extremely taboo right now in the very sort of classic totem and taboo analytic sense of things. Mm-hmm. where it has taken on such charge, such
Yeah.
energy, as you say, that it becomes impossible to talk about. And the role of therapy is what you are meant to be able to trust is that I am not either pathologizing or actually, in some sense, validating in the common parlance ways that we mean it, which is to say accepting, saying it's good,
Right. Yeah.
but that I am just here to help you see what is
Mm-hmm.
and why it is and how it could be different if indeed that is what you want, right?
Yeah. Yeah. I'm thinking about how sometimes the strength of an analytic stance is not that it gives the client an experience of like, what's that Rogerian concept?
Unconditional positive regard,
Right.
loving mother,
Right. Yeah. It's like that can be valuable, but sometimes the strength of an analytic stance is non-judgmental curiosity.
Right.
That like
Right.
we're not here necessarily to accept or reject. We're here to be curious.
Mm-hmm.
And in that way, that is a kind of accepting because you're allowing it into the room. You're allowing it into the space.
Sure.
Like there's a kind of acceptance that's inherent to that stance.
Right.
But I think about how a lot of times with people who have been severely hurt in some way by a loved one,
Mm-hmm.
if you as the therapist, if I as the therapist am too tied to the idea of that's an abuser and you're the victim, you should hate them, they're bad,
Correct.
the therapy's only going to go so far.
Right.
And what I'm hearing you say is that this middle space of gender is if someone shows up with a particular gender identity, regardless of what it is, and I take the stance of either that's pathological or, okay, great, cool,
Whatever you say, kid.
right, that analytic space gets closed down.
Mm-hmm.
The question that's coming to my mind now is like, how do we as therapists, I'm not trying to gear this show towards therapists specifically, but it's the question on my mind. So here we go. How does a therapist develop the capacity to engage in that middle space with someone?
Mm-hmm. Mm-hmm. Mm-hmm.
It feels like the limitation there is usually around the therapist.
Mm-hmm. Mm-hmm.
I've had people who waited for me to catch up to them. They were already there, and I took some time getting there.
Mm-hmm. Mm-hmm.
So how do we as a field start working this muscle
Mm-hmm.
of being able to explore gender without collapsing onto one of the other sides of this split or
Mhm.
binary?
Mm-hmm. Mm-hmm. I think it is really challenging because as therapy has become a much more popular cultural practice, there's a lot of benefits to that. However, it also changes what people expect to get out of it.
Yeah.
Right? So the idea that the therapist is going to be a companion, a professional who is non-judgmental but is invested in you
Mm-hmm.
feels less so, I think, than the kind of cultural notion right now that a therapist is like a souped up best friend, right? Or like a really nice aunt.
Right.
Where like, it's someone to be able to talk to and who's always going to take your side. So now in one way, that's not untrue. My alliance is always to helping the client understand themselves better.
Right.
But that's not necessarily with any given part of that client. Because my understanding is that we are always at odds with ourselves. So if I go ahead and say, yes, this part is all good, then some other part gets left out in the cold.
Right.
And so I see it as the most respectful thing to be able to hold a lot of space for all the possibilities in my client. Now, there's two things that can happen there, though, right? Again, in silence, in blank slate, in not directly kind of officially affiliating ourselves with a validating stance, we really risk being seen as standing too close to the bigots, as you said, right? I think that's a good phrase. I think it is on us, for whatever reasons, it is our responsibility at this moment in time to help clients understand, I am here for your exploration. That means respecting all parts of you, and I do. And so I want us to be able to talk about anything and everything that comes to mind. I think we can be limited in a number of ways, not the least of which is I want to be liked.
Yeah.
That it makes us uncomfortable to feel like a client might be uncomfortable not knowing what we think about something.
Yeah.
Now, of course, there comes a place in the treatment where if you can't come back because you're so uncomfortable not knowing who I am and what I'm about, then that's a problem. We want the treatment to continue, right? That's an old Lacanian stone, right? The therapist's desire is that the treatment continues, the analyst's desire. So at some point, we need to do what we need to do for the treatment to continue, but we also maybe need to be okay with not necessarily being seen as the likable cheerleader and, souped up best friend.
Right.
And that's a challenging place to sit in. In some ways, I have a lot of these conversations, and I think you're in a less enviable position than me, because whether it's transferential or not, people look at me and assume they know something about my friendliness of stance that allows me to take a really open, explorative, and sometimes provocative stance because, they know something about the pronouns I use that are in my email signature, about the way that I look, that makes them confident enough that I'm not out here like voting that they don't get medical care.
Right.
So that frees the ground for us to actually talk.
Right. Yeah, I'm thinking about, I had a supervisor once who, this is kind of a funny story. At the time, I was subleasing. My office was not my office. I was actually subleasing from a man who was a Greek Orthodox priest. And so the office was full of icons, right? And I was seeing this supervisor who was analytically informed, deeply analytically informed, and also like a little rigid, a little old school, I suppose is one way to say it. And we were reading a transcript of a session, and the client made some comments about one of the Theotokos icons on the wall. And my supervisor said, you do therapy in a room full of sacred icons? Like, why would you interfere with the transference like that? And I looked around his office, which was full of nudes and had a lot of exposed breasts and a giant bust of Friedrich Nietzsche in the corner. And I was like, interfere with the transference? What are you talking about, dude?
Everything is something.
Exactly.
Yeah.
And I bring that up in part because I have a bookshelf that faces the couch where my clients sit. And I'm very intentional about what's on that bookshelf. And one of the things that's on that bookshelf is the book, The Transgender Child. And that's my way. If someone were just to look at me, they wouldn't assume a thing about me. But as soon as they sit on my couch and notice that book, then I am actively encouraging them to think, okay, maybe Tyson at the very least is open to some of this stuff. Maybe he's not voting for them to get rid of my healthcare. And in certain analytic traditions, that would be considered interfering with the transference. And at least my decision to do that is in part because I am trying to interfere with the transference a little bit. I'm trying to step in and say, there's room for this. You don't need to hide this from me from the word go. And I can hear supervisors in my head telling me all the reasons that's bad, but I still find myself doing it.
I actually think that those kinds of non-verbal and visual markers can be tremendously helpful and informative because while they are expressions of self, they're one a little bit further back, right? And I know myself, right, as a trans person seeking medical care even, right, going to my doctors, finding a new doctor here in the Netherlands, right, I'm very on alert and very aware that there's a possibility of a lot of different people that I could encounter in that moment. Right. And so I do think that we have to make, I don't want to use the word safe because I think it's a really tricky one. We have to make the entryway clear enough that the treatment can begin and the treatment can continue. That the person can speak freely enough. Right, this was the whole idea of lay on the couch and don't look at me.
Right.
Is the idea that we have to create structural things, environments that allow for the client to speak freely. Incidentally, I was just in London a few weeks ago and I went to Freud's house, his last residence that he had there when he fled the Nazis.
Yeah.
And they've kept his original office and his last office in which he saw his final patients up to the time of his death. They've preserved it exactly as he had it. Full of architectural figurines and little statues and things from his travels. And I mean hundreds. Out on the couch, out on the shelves, paintings. I mean, the man was chock-a-block of transferential interference. Also sent his patients birthday cards. I mean, we canonize these figures who tell us something useful, which is, maybe don't go off with your opinions every 2 seconds in this conversation. Maybe this is a different kind of conversation. And then we make that into these incredibly strict rules that also don't make any sense.
Yeah.
There's no way. I do believe in not putting tons of myself in the therapy because I think that is interference, right? When I directly convey aspects of my own life and opinion, but I can't help but do it indirectly. There's no way for me not to.
Right.
I'm a person. I wear clothes. I have a home. I drink a beverage. All of these things are information. There's no way to get around that information.
Right.
So the idea that we can either offer information or no is just ludicrous.
Right.
It is about how do we attend to the information we present.
Right.
So I think these kinds of sort of nonverbal signals can be really good ways of trying to lower that just enough to clear the entryway for conversation to begin.
Right.
And to be client-led, which again is what we always learn from psychoanalysis, right?
Yeah.
It is not my job to come in here and say, here's what we ought to talk about, or here's what I think your problems are about. It is for you to lead me and for the unconscious really to lead me, which is to say you don't even know where we are always going to go
Right.
because there's so many yous in there and they all have different motivations. So we've got to both listen really carefully and see where are the places that some parts you don't want us to go.
Yeah.
And that leading, allowing the client to lead is another way in which we can, I think, make space for gender and make space for those conversations when they come up without rolling in there. Either to say, I think you being mad about your roommate doing the dishes is because, of your gender and theirs, nor to say there's nothing to do with it here. It's not my job to say either of those things. It's to understand where the person is coming from and helping them to see where there might be aspects of their experience that appear otherwise.
Yeah. Yeah. So if the person listening to this is trans or in some way gender nonconforming, and they want the kind of therapy we are talking about, how can we try to help them find it?
Yeah, that's a great question. And I always recommend, when trans people ask me for therapist recommendations, I recommend that they find an analyst. And I give them that with a warning.
Yeah.
That I say, look, I think you should look for a psychoanalyst. I say that because I'm almost certainly the first and only person who has said that to them. Again, we don't do that anymore.
Right.
That's all outdated
Right.
bullshit.
Yep.
And for trans people especially, rightly so, they've picked up, even if just culturally, like,
Right.
those folks seem obsessed with genitals and like, that's not the road that I should be going down.
Right.
So what I often, if a trans person is coming to me saying, I want therapy, what should I do? I ask them what they want out of that experience, of course, right? But for most folks, I say, I think you should look for an analyst, and here's why. What you're likely to encounter when you're looking at those folks, when you're looking at their pictures on Psychology Today, is they're likely to look less like you. They're likely to be older than you. They may say things that feel inexplicable to you or are couched in language that feels inaccessible. For all those reasons, I understand why you would not want to select those people. And going with people who look like you, who use words that are really familiar to you, especially now that therapy language has sort of seeped out into the culture.
Right.
Of course, that's going to feel more familiar to you. However, if you knew what the problem was, you wouldn't be in this bind.
Right.
And that is what psychoanalysis teaches us, right? If I knew what was going on, that I'm so depressed, and it was just sitting there on the surface for me, well, then I would have figured it out. Or at least that's the optimist in me, right? I need someone who is willing to look in other places. And so what I do tell folks is I would recommend seeking out these folks because what that word, psychoanalytic fundamentally means is that they're going to be willing to attend to all parts of your experience, or at least they should. Can I guarantee that? No. People tell me the craziest shit that therapists are out here doing and saying, and I truly cannot believe it.
Yeah.
Of every variety, of every orientation.
Oh, yeah. Oh, yeah.
So is there ever a guarantee? No. But if you go to these people, these are people whose foundational belief should be really non-judgment.
Yeah.
And there should be an absolute exploration of all parts. If you go to someone else who is advertising themselves as like a trans specialist, what that's likely to mean is that they're going to know a lot of content, or they're going to think they know a lot of content about you.
Yeah.
And some of that will be real. They'll likely know the words better. They'll likely know procedures better.
Sure.
But they will think they know you. And you already think you know you. So you need someone who doesn't think they know you. I mean, Bruce Fink, my mentor, has an essay on a critique of empathy.
Yeah.
Because empathy imagines, I know what it's like for you.
Yeah.
And while we think of empathy as just a universal good, there are limitations to the idea that I am empathizing with your perspective, which means I think I know what it's like for you. And in some ways, I can never know what it is like for you.
Yeah.
And the most respectful thing that I can do is let you tell me what it is like for you.
Right.
And when we are doing our jobs well as analytic therapists, I think we are doing that.
Yeah.
We are genuinely providing people with the experience of, I am curious, which is not interrogatory. I want you to show me who you are, because I want you to see more and more fully who you are. That's a part of me that allies with you, right? But it allies with the desire for more, not with any particular content area.
Right. Yes. There have been a few times in my career where I've had clients say something along the lines of like, I feel different and I feel like more of myself. And whenever that has happened, I'm like, okay, great. I'm not totally off the mark here. I think that is the goal of an analytic treatment. And I do think that psychoanalysis does provide us with a lot of ways to approach people with that, you know, beyond without memory or desire concept, right? Just like, I'm just here and I want to know you. And there's limitations to that for sure, but it's curious how, again, especially around categories of gender, people can use even theories that are designed to encourage questioning to assume knowledge. I've been seeing a supervisor for a few years, and I feel like for the first like 2 or 3 years of our work together, she was just trying to get me to like question all these assumptions I was making about people all the time.
Right.
Gosh, yes, that answer was beautiful, and it clearly took my mind on some great directions. That's lovely. So for people who are listening to this who have never really explored or questioned or engaged with gender in that middle space, cis, trans, unknown, neither, like, I think there are many people who haven't stepped into that middle space of curiosity, where it's either pathologizing or sort of like flat affirmation.
Sure.
How would you try to, I don't know, induct someone into that middle space of exploration? How would you invite them into that space?
Well, I mean, I think we could all actually use doing it more, in my opinion, for all genders. I think actually this is a weak point in which we can fail to engage with gender as like a really important concept for all people. So before I was a transgender specialist, I was a feminist scholar. Certainly the feminist therapies have a lot to them in terms of what they believe about the stance of the therapist. But they're also certainly be calling attention to like, this is an important part of experience, and it's one that doesn't get talked about. So again, this is the foundation of psychoanalysis, that when experiences are informative, but they don't get talked about, then we have problems as a result.
Right.
And that just becomes more true the more marginalized your gender is, right? So we get feminist studies because women as a marginalized gender are made to be more aware of the ways in which gender does impact their experience. It doesn't actually mean it impacts it less than men. It just is easier to notice because the impact is usually more harmful and negative. Right? In the same way, I mean, we can make the same comparison to race, to all kinds of identities, right? Everyone is impacted, by where they stand. For some people, they are made to be aware of that a hell of a lot sooner than others because the impact is dramatic and it's quite negative. Right. So, and that's especially true, for transgender people as well here. Right. But everyone could do with a little more investigation of gender as one of the important things that leads us to where we are and that informs our perspectives and informs our experiences. I remember my dissertation, which was about feminist culture jamming, a form of activism that takes over mainstream media outlets to send feminist messages. I remember sitting in a bar with a colleague who was telling me, that I was off base with all of this way that I was thinking because I was shaping the clients. A client is telling me about her experience at night and she had to go home at a certain time. She has to go home because she needs to walk in a certain way. It's going to be too dark, right? That is a part of experience that I can inquire into. What is it like to feel so unsafe in the world? What is it like to know that your experiences are curtailed by the body that you have, right? You accuse me of this kind of interference. You're shaping their experience. To my mind, we are always shaping their experience. Again, there's nothing you can do. Why every question you ask, every statement you make indicates whether you mean it to or not, something to the client about where the interest is. So why not help lead their interest back to Freud, back to sex and violence, back to taboo, to the places that they are unlikely to uncover themselves?
So I'm imagining a listener who's like listening to this and is like, okay, I'm on board. How do I start this process? I'm open to exploring my gender, how I use it, where it comes from, what it's about, all the different meanings that are unspoken for me. How should I get started here?
Oh, I wish I had a better answer of a 1, 2, 3 kind of step-by-step guide to being your trans affirming therapist. I mean,
sure.
I think this work is difficult when done well. This work is abstract when done well. It is the reason that we are analysts and not CBT therapists.
Right.
I think there's a very good place for CBT in the world. I think every high school should have a CBT course. There's good stuff in there about how to control your breath.
Absolutely.
I don't think it's the modality for when you have a question you can't answer about yourself.
Right. Yeah.
I think we are the modality, and we are the modality because we don't have clear steps, but we do have sets of principles. Right? We do have sets of stances. So I think a listener who has listened this far in this conversation and is feeling on board, there's a lot of what we've already talked about that might be a little more, I don't know, I guess practical, right? How can you use your office to kind of signify some things about your stance and what is okay to talk about there? How can you use your website copy to do the same, right? My website is like a wall of text, but it does so because I have 3 sections: slowing down, talking, and listening. These are the 3 most important principles in my practice. And I've got like 5 paragraphs on what each of those incredibly simple things mean. Because I want people who come to see me to understand that that's what I'm doing and that's what they can expect from me. I try to do a lot of lift in my orientations and intake interviews to let folks know, here's how I'm going to act, and here is why I am acting that way. I am not going to start our conversations in a certain place. That's not because I don't remember what we were talking about last time. That's because I want to make space for all the things that might be here.
Right.
I might sometimes ask you questions about something that feels totally unrelated to what you're talking about. That is not because I'm not listening. That is because I'm wondering if something else could be at play here. When I ask a question, it's not a statement. I don't know that thing might be related here, but I'm asking if it is. Right. None of this gets me out of transference.
Right.
None of this gets me out of them actually, having those responses and feelings when they come. In the same way, when I was teaching, I would have like 10-page syllabi, right? Because my strategy was like, I'm going to build in all the nice guy room and all the clarity here up front so that then when we hit the line, we hit the line.
Right.
So in some ways, it's a little similar, right? I try to make it very clear to clients who I am and where I'm calling from so that they can have that reassurance about why I make the choices that I do in speech
Yeah.
and in conversation.
Yeah.
Doesn't get us out of these kinds of conflicts,
Yeah.
tensions, issues.
Yeah.
And that's where we have to be comfortable with being uncomfortable. We have to be comfortable with not being liked. We have to be comfortable with not being perceived in the ways we want to be.
Right.
We want to be seen as proficient. We want to be seen as knowledgeable. We want to be seen as compassionate. We want to be seen as whatever we're seen as.
Yeah.
But part of the deal of the analytic relationship is I don't get my needs met here.
Mm-hmm.
I forego part of my humanity to give you back more of yours.
Mm.
So I have to be okay with the fact that maybe they don't always see me as a nice guy, and maybe they don't always understand me.
Yeah.
And maybe sometimes they see me in ways that are deeply incongruent with the ways that I see myself.
Mm-hmm.
And as long as that is moving the treatment forward and helping them to further uncover parts of themselves and be curious about them, I am doing my job.
Right. Yeah. Ugh. And that is exhausting. That requires a kind of stamina.
It's a tough job.
It's a tough job.
It's a tough job when you're doing it well. I understand why people take different perspectives that allow more of themselves in the room or that allow for more kind of step-by-steps. I understand it deeply.
Yeah.
Like, it feels better. It feels better to feel like I can clearly give you something that's helpful.
Yeah.
It feels better to feel like there's at least a little bit of two-way to this relationship, or you're grateful for what I give you,
Right.
or you like it. Of course it feels good. That's how relationships are literally meant to work.
Right.
This is a very strange one, and it works because it is not like any other relationship that you have.
Right. If we were CBT therapists, I could ask that question about how does someone step into that middle space of exploring gender, and you'd be able to have a workbook that you published.
Yeah. They're going to write down their thoughts. We're going to see if they're valid or not. We're going to see how many people actually which is not to say I don't sometimes do these things,
Sure.
right? When I do have a client who's having like huge passing anxiety and they're not leaving their house, sometimes we might reach a point where I'm like, we've talked about all of the things going here. And is that happening?
Right.
Can we help get you to a place of understanding like what's going on so that you can get to work?
Yeah. Yeah.
We have to include a lot of things sometimes.
Yeah. We can't be monomaniacal about it.
I think in many ways, trans people are the new hysterics, right? Insofar as we are a group of people who are expressing through the body and who are experiencing hugely culturally evaluative interpretations of what that means.
Yeah. Wow. Yeah.
The conversation gets forced again and again into these narrow channels of is it right or wrong? Are you sick or well? And that is the least interesting question to me, as opposed to how many different ways there are to live a life, right? It's why I deeply reject biologic explanations of homosexuality or of gender variance. Because it continues, to my mind, to play into the same problem, well-intentioned, but the same problem, right? Which is to say, if it's in my brain that I'm gay, or if it's in my genes, or if I have a hormonal imbalance that made me this way, then you can't blame me for making such a bad choice, for doing such a bad, perverse thing with my life, because I couldn't help it. I was born this way.
Yeah.
And I reject that because A, it gets us nowhere out of the same maze of whether it's wrong or right. And B, it gives me no credit for the choices that I have made in my life, and they have been hard choices. Because in fact, I did have other choices of what to do. I could have chosen to live unhappily. I could have chosen to kill myself. Those are choices that are open to me.
Yeah.
That's the existentialist in me.
Right.
And I didn't. I chose to do something that is actually very strange and very hard. And I didn't do that because there's a biological set of genes inside me that leaves me with no choice. I did that because I am a thinking, feeling, interesting person, and I made my life what it is. And so I think we have to find some way to get out of this evaluative framework, which we get in over and over again. And that is quite literally what psychoanalysis was in part invented to do, was to provide a place where for once we're not seeing through the lens of is it right or is it wrong. We lose our way because our cultural trappings look awfully convincing. as if Freud's didn't, as if Anna O's didn't, as if all of those women weren't equally convinced, and all the people treating them, that this was the only way to talk about their problems, or the only way to see them as biologic problems. Right?
Yeah, I'm aware of time, and I just want to say for the listener who's not as versed in the history of psychoanalysis, when Cameron is saying trans people are the new hysterics, that's hugely significant because women with strange, oftentimes physiological symptoms with no other cause, who started talking about their experiences of their lives and their emotional experiences and their traumas and their memories and their desires to Sigmund Freud, is the origin of psychoanalysis and therefore psychotherapy. That's where it started. Women whose bodies were holding pain that was only worked through in the context of a discussion with someone who was curious. And a bunch of other things. It explodes from there. But I want to say that because I think the parallel here is both powerful and also deeply confronting to a culture that just wants to say, but is it valid or is it not? What I'm hearing you say is, who cares? It's deeply rich with lived human experience that's full of meaning making, of humanity, of joy, of sorrow, of life. And if we can get over ourselves and the question of whether or not we can treat it as real, we might actually find such a breadth of humanity with so much to share. And that would be a very different way of approaching one another.
Yeah. I think that's incredibly well summarized, and I have my own fears, right? I can hear the turfs in the back of my head, right? Of like, okay, so if trans people are the new hysterics, well, how those women got well was they talked about it. They didn't change their bodies. And that's exactly what we're advocating. You talk with these mentally ill people and then their problems will go away and they won't need to change their bodies. So, but to my point, who cares? What's it to you, man? I mean, we make all kinds of modifications to our bodies all the time, including permanent ones. We get tattoos, we get piercings, we change our hair, we make decisions that we could regret, which is to say we feel differently about, that another self in the future feels differently about the actions of a self in the past. We do this. This is the stuff of life.
Yeah.
So the fact that we even consider that all of our minds, mine included, goes back into those straits again and again and again, right? Is speaks to how strong they are.
Yeah.
How this evaluative litmus, it wants to yank us back at every point.
Yeah.
The way that I write letters is deeply informed by, we all make choices. That is the business of being human.
Yeah.
Is that you have to make choices about what to do with your life and with your body. I cannot say whether you will feel the same way about any choice tomorrow, in 5 years, in 10 years, or in 30 as you do today. Many of them, I hope not. If we felt the same way about every single choice we made in perpetuity, this would be a suffocating life. But who cares? Yeah. Is sameness the goal? It only becomes the question over and over again because there is something so disturbing to us about this level of change, about the idea that gender, that sex, really, because that's where we really have the problem. Go dress in whatever clothes you want and grow your hair out. But if you want to change your sex, now we got a problem. We got a problem because it is disturbing to me about the way I think about my sex as immutable. And if you're going to go off and change it and do this weird thing, then that might mean that actually some things about me may not be quite so permanent or quite so inbred as I believe them to be.
Yeah. Yep. This is making me think of, this might be a good segue, Paul Preciado's lecture and book, Can the Monster Speak?, where he talks about this, about how powerful the pullback, the phrase he uses in that is the regime of sexual difference.
Yes.
Like how strong that pull is, how easy it is to return to it. So on that theme, referencing folks, you've referenced a couple of folks who I'll put in the show notes, Discipline and Punish, Foucault, Evolution's Rainbow. I'll have that in the show notes, listener. Any other further learning for someone whose brain is on fire and wants to keep diving into this that you'd recommend?
Anyone who's interested in like a really good kind of intro primer on social constructionism, given that that's a phrase we've used a lot, there is a great primer. I would describe it as very accessible to students and lay people. The author's name is Vivian Burr, Burr, and it is titled Social Constructionism.
Great.
It is a great entry point that's quite easy for folks to get into. I put a few references on the form. They're rather academic, though. Patricia Garavici, Lacanian psychoanalyst who's thinking a lot about gender in really interesting ways. Avgi, whose last name I still can't pronounce.
Yes. Avgi Sagatopoulou, I believe.
Yes, who's doing really interesting, wonderful things, I think is often deeply misunderstood because she's really refusing the terms of engagement here as, you're either on board and that means all these 5 stances, or you are, a hostile transphobe. And she's really constantly trying to interrogate and speak to that middle in the language she uses in a way that I think is really interesting and compelling.
Yeah.
Susan Stryker is another author listed there who's a great trans historian and writer. She's got some great works of her own. There's a great collection of reading Susan Stryker. There's also a monster anthology title, which I may have put in the show notes there.
Yeah.
If I think of any others, I will pass them along as well.
Absolutely. And listener, check the show notes because that's where I'll put them. Finally, would you like to plug anything? Where can people find you where you would like to be found?
So you can find me at my website most easily. That's www.untanglepsychotherapy.com. That is the present tense, untangle, not untangled. I'm afraid mimics have popped up all over the U.S.
Oh, no.
It's a common concept. So Untangle Psychotherapy is me. That's my practice name. You can find a wall of text, as noted, on my website there about how I practice. I do also offer supervision and consultation. So if you do have therapists who are listening to this, who are feeling really interested in these topics, who do want to talk more really specifically, how do I've got a trans client and I want to communicate these things to them, but I don't know how. Or I've got someone who's interested in gender exploration and I feel out of my depth with that conversation. I do offer supervision in an ongoing fashion as well as consultation, one-time meeting, where I can absolutely do case consultations and talk about what some of those specifics might look like for a given therapist with a given client.
Yeah.
So folks who are listening to this who may be themselves professionals and working within these fields or want to know more, please check me out on my website. I've got a contact form there, as well as you can email me at drbboisen@untanglepsychotherapy.com. And I'm very happy to have both individual consultation and supervision, as well as I do have prepared presentations for group practices or trainees for sort of letter writing 101 or folks interested to get started with that kind of practice.
Awesome. And links to all that stuff will also be in the show notes, listener. So if you're curious and want something clickable, just check those out. Cameron, Dr. Boisen, thank you so much for your time, for making this dream of mine a reality. I feel like we've scratched the surface of something. And if this show goes into multiple seasons, I would love to have you back to continue diving deeper on this topic or others. I've really appreciated your voice and perspective. So thank you so much.
Thank you, Tyson. It was a pleasure to have, and I hope an informative conversation for the listeners.
Very special thanks to Dr. Cameron Boisen. Dr. Boisen's contact information, including their website, can be found in the show notes. Also in the show notes are links to some of the resources for further learning that Cameron mentioned during this episode. I hope you'll join me again in 2 weeks when I speak with Hannah Knapp on the topic of body justice and fat liberation.
This has been The Way In. This show is hosted and produced by me, Tyson Connor, with music by Ben Lewis and visual art by Dan Lane. If you enjoyed this show, please rate, review, subscribe, follow, like, share, star, heart, reblog, retweet, repost, upvote, or in some meaningful way engage with the episode on your digital platform of choice. I'm told it makes a big difference for exposing more people to the show. And if you think someone you know may like this episode, you could also just tell them about it. You can follow the show on social media, where we are at The Way In Pod. There you can give me feedback, tell me a joke, and see high-resolution versions of the individual episode art, which I highly recommend. I think Dan did a great job.
Thank you for joining us. Until next time. Oh boy, I'm going to edit this to be a little bit smoother.
I'm giving you way too much.
No, this is exactly what I want. I feel like I'm a rocket. Like I'm shooting into the stratosphere right now. So, okay.